Good afternoon, everybody. My name is Amy Goldman, and I'm with the AT3 Center. Delighted to bring you today's session, Moving into the Green Zone, Planning for AT Program Operations in a COVID-19 World. So the Green Zone is what Governor Wolf of Pennsylvania is doing to code the phases of the Commonwealth reopening. And I'm in Philly, which is currently in the red zone, but at this point, most of Pennsylvania is yellow, and many of the more rural counties are moving into the green zone. And your governors may have different schemes, but now you know why I've titled it this way. I'm very pleased to bring you four panelists: Angela Standridge from Texas, Tracy Castillo from Indiana, Sarah Sack from Kansas, and Molly Kimmel from Montana. We did have Rick Anderson also on the panel, but at the last minute, he was unable to join. So just a few reminders. To see captions, click on the CC button on the control panel. Please enter your questions and comments in the chat window. Comments and questions will be addressed at the conclusion of the panel. So our four panelists will give their presentation, and then we will cycle back and review comments and questions. We do hope that you will participate in that last segment of our session to share your resources and thoughts on the topic. As usual, for upcoming events, check in at at3center.net events page. And as you know by now, registration links will be sent out via the AT3 listserv. Archived webinars can be viewed at the AT3 Center's YouTube channel, which is all one word, AT3 Center Videos. Subscribe today. Many of them, if not all of them, are already posted on the AT3 Center website on the emergency preparedness page, but it may be easier for you to find them on the YouTube channel. So do subscribe today. When you receive a post-webinar survey, we appreciate it if you complete them for us. You all know the importance of evaluating our activities. So today's description, our panelists will talk about their planning process, including any resources they used in developing their plans, considerations in protecting staff and consumers will be described, and again, you all are encouraged to share your information. So we'll address the planning process for entering the green zone, planning for all hazards, continuity of operations. I'm sure you all know that June 1st was the start of hurricane season. And actually, yesterday in Pennsylvania, we had Derecho, which are those flat line winds, tornado warnings, and I think in the next couple of weeks, there's supposed to be a meteor passing near the Earth. Anyway, we'll be addressing the safety of staff, the safety of visitors to your site, the safety of borrowers and recipients of loaned or donated equipment. We'll talk about obtaining sufficient supplies in order to carry out enhanced sanitization. For those of you who have subcontractors, how are you supporting them? What changes or rearrangements are you making in your physical space? And budget modifications necessitated by these program changes. You may recall that AT3 did a similar session just as things were beginning to get tough in March. And similarly, we will probably be revisiting this topic in the fall. Hopefully it won't be a second wave, but still worthwhile to see how our plans are actually operating. So a few resources for you. If you search for this article from Forbes, Leaders, How to Prepare for the Mental Health Challenges of Reopening, I found that very interesting one. Back to Work Toolkit, and then CDC guidance. And the CDC guidance is posted on the AT3 COVID-19 page. So, without further ado, I'd like to turn the program over to Angela.
Hi, y'all. I'm gonna share my screen. Everybody seeing it?
Not yet.
Now?
You got it.
Okie dokie. So we're in Texas. It's already hot here. I am out of the University of Texas in Austin, and there's all the various contact information if you want documents or follow-up after this. So Texas and the University of Texas and reopening. So I don't know if you followed the news, but Texas never really completely closed down. The governor had everybody's social distance, and if you could stay home, you probably should, and work from home if you can. Municipalities and counties did more restrictive stay-at-home orders. So we were all over the place. We were never really completely on one page with that. University of Texas closed down the 15th of March and has still been closed down. They are planning to have summer classes virtually, and even though we were closed down, you could still go badge into your building and do things, but they wanted you to not be there if you didn't need to be there for security reasons and for the COVID reasons. So then Texas reopened, even though we never really shut down, and we did it probably a little bit early, probably 2 weeks too early. We were right at the top of our peak, and that's when the governor started opening everything up. I think now we're at like 50% capacity in restaurants, and I can't keep track of a list of which businesses are open and which aren't, so on and so on. So it's sort of a big mess. We anticipate, we being my department, the Texas Center for Disability Studies at UT, second and third waves across Texas, probably spread out. You know, University of Texas is not just the facility in Austin, it's all over Texas. There's institutions all over Texas, and my demo centers are spread throughout Texas. So there's 16 demo centers spread geographically throughout the state. So we're really gonna have to monitor local areas to see what's happening. And I've talked with my demo centers, I've told them what they really need to do first is follow their organization and institutions' protocols and recommendations. And they're different ones. So some of them are Easter seals, some of them are SIL, some of them are area agencies on aging, one of them is a rehab facility. So there are all kinds of different facilities that are gonna have all kinds of different rules, and they have all kinds of different typical customer bases. So it's very squishy how that's gonna look. UT has said they are going to make final decisions about the fall by June 30th. Every other major university in Texas has already put everything out there. The media's reported it. UT's like, I don't know, we're not sure yet. So we anticipate that they're doing things like they want to try to spread classes out. So most classes used to be between 10 and 2. So now they're gonna make more evening classes and more early morning classes and more mixed classes that are hybrid, face-to-face and virtual, and then all instructors have to be willing to go remote on a whim or with the flip of a switch, because they anticipate outbreaks on campus because they are going to have students back in the fall. We have to wear masks when we're in the buildings at all times. If you have an office with a door, you can take your mask off when you're in your office. And we're lucky enough for TTAP, we're sort of on not the main campus, we're on a research campus that's north of the main area, not near downtown, where currently all the protests are anyway, so that's good too. So it's a separate campus, and our building on the campus is not that busy. It's actually a professional development building that they kind of took half of it and turned it into offices. And that's where we are. And unless there's an event going on, there's nobody hardly there. And I'm anticipating probably less events because of COVID. So, or we can just stay out of that area of the building if there is an event. And then within our area, all of our offices do have doors. So that's a plus. UT anticipates needing about 500 COVID-19 tests per week next year in the fall to keep faculty, staff, and students tested. So they're already anticipating that's going to be an issue, and they're going to have to do contact tracing. And of course, they're all involved in the research on all that anyway, so they're kind of on top of that. So we'll see what happens with all that. So I put question marks on my graphics. I have two graphics, one of Texas and one of the UT Longhorn, with the big blue question marks on them because we really don't know yet. So what about TTAP? Are we reopened? Yes. We have a draft plan, and when you get the copy of the PowerPoint, this is a hot link that will expire on 6/30 because UT doesn't let us keep our box links active for much longer than that. If you want a copy, I'll be happy to just email it directly to you if you contact me. And then Amy has it too. So any of those sources, you can get a copy of this. It is a draft. Give me just a second to open it here. I'll move it over to the screen.
And Angela, this is Amy. I just wanted to interject to let people know all of the resources that our great panelists are showing today will be posted in about a week at the same time that the recorded video is posted.
Thank you. So this is a draft. It's got a watermark of a draft. There's probably even typos in it. I'm having my team read over it, and also we might even run it by legal because of the liability piece we're not really sure about. So there's other kind of subsequent appendices we want to add to that. But we've got our protocols for the loan library, but we're upping them just a little bit. We do have access to PPE because apparently UT's buy board, there's a source on the buy board and they have to sell it to us first or something like that in the contract. So we have been able to get that. I am sending each of my demo centers like a little starter kit with gloves, one of the approved wipes, and we got some of those face shields from MIT. It's basically a die-cut piece of clear plastic, and then you fold it into a face shield, and it magically works fine. They're relatively inexpensive, and they packed well, and they shipped well. So that was my motivation for that. And it's not really so much that I think anybody's going to get the virus from devices that they're touching or that we're cleaning, but what I'm concerned about is people touching their faces. And if you have that clear plastic shield on your face, even with gloves on, you're not going to be touching your face. That's what my bigger concern was. So we've got our protocol. I've got suggestions for demonstration centers. And again, their organization's policies will supersede any of ours. Presentations and outreach, that's all virtual. And then I included information on like the CDC protocol for washing hands. How do you do that right? The questionnaires that demo centers should be asking when they're having clients come in for a demonstration. Probably most of those entities are going to have questionnaires they're already using. I just got a sample one. And then I'll probably update some of these links as well for the most current information on Texas, on Austin, and then I may even add some of the cities that my actual demo centers are in. I wasn't real sure how deep we're going to go with that. So you're welcome to take it, use it, abuse it, whatever you want to do with that document. I don't mind sharing it. So we are opening up the loan library the 1st of June, but we had a backlog of 40 items to check in. So 40 items have been received and we had to check those in. And then we also have, I think about another 40 that are waiting to be sent out. So we wanted to get rid of this backlog first. And then the 15th, we're back in business for people to go online and make requests or email or call if they want to borrow equipment. We always ship FedEx both ways. Very few people ever come to our center because it's Texas and everything's spread out. So that really wasn't an issue for us. We repurposed a storage room to do this. So now our other room, our other library, loan library office is a little packed. We had at one time thought we were going to make it one big giant room and store things more efficiently. Well, now all capital outlay is canceled anyway. So now we just repurposed that. And I've got some pictures to show you in a minute of how we made our little area for our receiving area, cleaning area, and then to go put the things up. I talked about the buy-board art. Oops, sorry about that. For UV, we researched that a little bit, but it's still a little bit sketchy, both on whether UV is effective on COVID-19, and then also how long COVID-19 stays on surfaces. They keep changing the information on that. So I don't think we're going to go there. To get gadgets, to get something that was big enough to put our gadgets in was really expensive. And it kind of fell into two categories. There was like these little personal use type items for like phones and things like that, laptops, and they were in the $100 to $200 range, but they were small and they wouldn't hold your average AAC device or your larger like CCTVs or things that that are about that big. And then when you got into the bigger ones, they were these gadgets that were for labs, and they had a lot more features that we really didn't need. And so one, we weren't really sure if it was making a difference, and two, it was kind of pricey. We looked at some wands, but there's not any that you can get because they're all sold out. And there was some risks with that, even though most of them, when you turn them right side up, the UV turns off, but UV light is not good to expose yourself to. I did find a build your own, whoops, I don't know, I'm going crazy with my mouse today, sorry about that. Build your own UV box with about $50 of materials from, it didn't click, let me try that again, from Home Depot or wherever. So all you makers out there, you can follow that link. And it's really just very pretty simple. You buy one of those big crates, those big plastic crates, you line it, you put your light in it, and then you have your, and you can make it as big as you want it to be and use a light accordingly to how big you need your thing to be. But one of those crates would certainly hold sorry, I cannot talk and click today, would certainly hold an AAC device. Then this next one here is the pictures of our room. So what we did is, this is a little cart that our FedEx guy comes, and we put all the packages on the cart, and then we move them over to this little table over here. Those are the ones we had to process. You can see we got quite a stack there, and we're going to let them sit for 3 to 5 days. Then they move to this table, and we've got our PPE sitting there ready to go, and we clean it, let it dry, and then we'll put it up in the cabinet. And you can see we couldn't quite empty this room all the way, so there is some items back behind that table, and there's a cabinet over here full of stuff, and then over to the right of this desk there's a cabinet as well. So there is our pending right there, and there's our little, we might make a little rack or something to put all the PPE on so it's not on the same table as all the cleaning items. And then as far as demonstration centers, right now we're doing them only remotely. I offered to buy demo centers like cameras and tripods and better headsets, and nobody took me up on that. Instead, they just sent all of their remote demos to me. So I've been a little busier with that. The centers are all over the board with where they're opening and not opening. Some people are still at home. Some people never closed. So it's 16 different ways that I'm dealing with that. The protocol for in-person demos, for us, we could do that, but again, we don't get as much traffic there as some of the other places do, and those institutions are going to be able to govern when they can see people again. We're sending them like I said, a starter PPE kit. Everything else is virtual. The one silver lining I will say that happened from all of this is that because we've started doing everything virtually and people are connecting a bit more, I have been able to connect with some stakeholders that I could not connect with previously as well. So, you know, some state folks, you know, grant money is coming down. Some of the grant money says, you know, explore assistive technology for people with disabilities or people that are aging. So people have reached out to me, and then I've had some opportunities as well. So that's what I'm going to call the win for the whole COVID is we made a few more connections, and we've got some more activities and grants and things in the pike to work on in the future. And I think I'm right at my time, so I will unshare my screen if I can find my little bar here and turn it over to the next person.
Great. Thank you so much, Angela. And by the way, some of you are having issues because Zoom has made some changes to the interface. So if your PowerPoint is showing really tiny, click on it and it should restore to a better view for you. Thank you, John Brandt, for that tip as always. So next up, Tracy.
Hey everyone, my name is Tracy Castillo and I am the program manager for the Data project out of Indianapolis, and I am inside of a nonprofit. And I'd like to say that working within a nonprofit has had its own challenges. Our organization deals with many high-risk individuals and then took that in account early on. So Easter Seals actually stopped seeing individuals in the building about mid-March. Many of the programs were sent home to work. This would include our employment services, autism services. Adult Day was not able to carry on their services in the building, and many more. As for the Data project, Brian Norton, he followed along with many of the other state acts, and he decided to like halt all our services. So beginning mid-March, we paused all incoming loans. Instead of requiring people to return items, we extended those loans. Our device reuse program was also affected. We weren't able to give out hardly any computers, and I will say hardly any because as you'll hear later, I'll talk about Alvin. He did go above and beyond and deliver a few computers as the masked man. The masked man, he would drop the computer off at the people's house and take off running and ask for the paperwork later. So we stopped all our distributions because of all the closures. Many of our events were closed, all our booths stopped. I found that disheartening. We had put a lot of work trying to get into these booths. Now they were all closed, and this lasted about a month and a half. We did have a few brave employees that stepped up and beyond and did provide computers to other individuals for telehealth services. But we did have a lot of success in our AFP loan program. That service seemed to go unscathed in this pandemic, and we actually reached our highest number of loans. And I guess to shout out to Nicole Prieto. She is the lady that does our AFPs, and she did a lot of hard work during this pandemic. So moving into the reopening phase of this conversation, I am going to show you something our governor gave us. This is, let me see if I can get this shared out to you guys. Okay. So Indiana is opening up in phases. There are a few counties in the state that are a week or two behind the current phase because they were some of the hardest hit areas. Marion County is where the state capital is. It is center in the state. It also has the highest number of confirmed cases of COVID-19. Marion County is also the county that our AT Act resides in. There are 5 stages in the Indiana's Back on Track plan, and currently Marion County is on stage 3, and we started stage 3 on June 1st, whereas the surrounding counties were on stage 3 May 22nd. And this phase allowed groups of up to 100 to get together and various businesses to open. And if you want, I provided Amy with this flyer with all the details. If you want to get into the nitty-gritty and see what we're allowed to do over here, you can. Now that we know where Indiana is, let's check out where our host organization is. So as Easter Seals decided to reopen, they only brought in a handful of programs as first. Last week, we brought in our autism services, the Adult Day program, and those programs were allowed to run first because they really couldn't do what they did from home, and a lot of people were missing out on work. There were people who were having problems with some of the guidelines that they put out. So they gave this flyer out to everyone that was employed for us to go over and to kind of have some guidelines on what to do if someone does not feel like following some of the rules. And so as we are governed by our host organization on reopening, and on June 1st, after some of the programs were able to open, we have begun to open very slowly. After May 21st, I actually saw an uptick in our calls. Before that, I wasn't getting hardly any calls, and we have a very comprehensive reopening plan, and our organization gave us strict guidelines on how to see the consumers in the building. They also handed out this flyer. Let me go to my next one. So they asked if we had a formal plan. Amy wanted to know if we had a formal plan. We do have an extremely comprehensive plan. Because of the nature of Easter Seals Crossroads, our executive team leadership team requested that each program submit a plan that was very detailed and lay it out. This comprehensive plan addressed many, if not all, the concerns of the employees while staying within and going above and beyond the CDC guidelines. I don't have enough time to go over each item, but I will go over some of the most recognizable. So they talked about social distancing. Some of the things they did is in our lobby, they removed some of the chairs and created space in our lobby. They also put a 6-foot tape line in front of our receptionist and created a plexiglass barrier in front of her so she could check people in. And all items such as magazines and toys, things that were in the lobby for individuals to mess with while they're waiting for their appointments, they were all removed. The agency also set up sanitation stations on each floor, and they had signs reminding people to wash their hands. And they also established a heightened sanitation protocols. Now we do have an elevator in the building, so what they've told people is they're only allowing 2 people in the elevator at a time. And if the elevator is full, you can take the stairs. There's 2 sets of stairs. They're going to have people go up one set of stairs, and then they can come down the other set of stairs. Our organization is going to be providing us with masks, face shields, and hand sanitizer. So we get those. We can ask for those on a weekly basis. And everyone coming into the building must be wearing a mask, and they will be asked a handful of questions regarding if they've had a cough or trouble breathing, and if they've been exposed to anyone with COVID-19. After answering these questions, they will also take their temperature, and if you pass that, you get a bracelet and you're able to come into the building. And I wanted to talk about, before I go into my next slide or next flyer, I wanted to talk about our, about this. This is something that Brian gave us recently. Now, we did have a completely comprehensive plan within data and our assistive technology that talked about the movement of offices and workspaces to accommodate for social distancing. Again, I did not have enough time to share all the aspects of it, but it was something that we had to submit to our host agency for approval. And once we got approval, then we were able to start reopening our program. And I actually love our new setup. As we know, space is always an issue in what we do. And I feel like the new arrangements are is going to make my team more comfortable than we were, I like to say, BC, before Corona. Before Corona, we housed 4 employees and up to 6 volunteers in the same work area. And we would have at least 2 people in each workspace with a lot of equipment, and there was no room for social distancing. We did take some employees out of the depot. We call this area the data depot. And we took some people out of this area, and we put one in a storage space that used to house items for our clinical team. And we've moved those items into another shared workspace for our clinical team, seeing that now our clinical team will probably not be coming into the office as much. So I'm hopeful that some of these things will stick around even after this COVID has moved, because now each one of my employees has his own office space, whereas in his office he can remove their mask and then just be comfortable in their office. If you are not in your office, they want you to be wearing a mask on at all times. And of course, they're asking everyone that is, if they can work from home, to work from home. The last flyer I am going to show you is something that we did borrow some of these ideas from Alaska, and I want to thank Misty for allowing me to talk about it today. I did reach out to her and say, hey, something I'm showing today might seem familiar. So this is something that we have posted on our AT4All page, and we are also putting it in each one of our boxes that go out during the lending library. As you can see, it's just a nice diagram that someone can quickly look at and understand to see how we're doing things here. So what's going on? We're asking people that borrow things from the lending library just to do everything online. Before we reopened, we did set up an area in one of our old storage areas as a place to put items in there coming in for the lending library. We call it the lending library quarantine. So I think that's about all I have to talk about, but thank you.
Thank you, Tracy. That was really informative. We already had one question about, can we share what you borrowed from Alaska?
I guess Misty said it was okay. We can all have it. Hi, Misty.
Okay. And as I said before, all of the materials that you're seeing today will be posted on the AT3 Center website on the COVID page with the webinars. So thanks again. And now, gosh, ladies, we're doing great on time. Thanks for sticking to your limits. Sarah, tell us about what's happening in Kansas City.
All right.
I mean, in Kansas.
In Kansas. Yeah. Well, good afternoon, everyone. I'll share my screen and kind of walk you through what's been happening in Kansas. All right. I hope you can see this. All right. And it's not going to me. Not going. All right. I hope it's advancing now. We'll check it out and see. Assistive technology for Kansans. Well, the state of Kansas, we skipped one here. The state of Kansas actually closed the middle of March. So the governor issued a stay-at-home for all individuals. And so the University and Assistive Technology for Kansans closed their offices March 17th. I'm not sure this is, I don't think this is working. All right. Were you able to see my screen? You were, okay. All right, we'll go back and try it again. I just wasn't seeing any indication from anyone else. All right, so kind of go back and look at this. So the state of Kansas closed in mid-March. The university, which is our lead agency, they closed March 17th. So pretty much by St. Patrick's Day, the entire state was closed and we're at stay at home. So we had a number of efforts to bring our staff, our 24 staff members, so they were able to work from home. As I said, the lead agency is the University of Kansas, but we have a number of subcontractors across the state. So we have the 6 AT access sites, and the subcontractors for those sites are the SILs, there are the developmental disabilities organizations, and an educational unit. So they're all operating on different guidelines. So the 6 sites are closed as of the 17th of March, but with different plans for reopening and trying to reopen it as soon as the governor would allow it. Our governor has a phased in plan. We are now in the 2nd level. So Amy, we're past the yellow, but I don't know what our color would be because we've got essentially a 5-step plan. But so at this point, if you look at Kansas, we've done pretty well. We have, well, I guess pretty well. We have 10,000 cases.
Sarah, I think
Yeah.
you lost your screen share.
I lost my screen share. How? All right, let's try it again. I don't know why we lost the screen share, but sounding like we did. Do you have it now?
No,
No.
you're clicking on the screen share screen button on the bottom
Yep.
of the toolbar. Ah, that looks, there we go.
There we go. All right. Sorry about that, everyone. All right. This is a little different from what I'm used to. All right. So state of Kansas, well, it was a little rough here. Well, state of Kansas, 10,000 cases of positive cases, 208 deaths. And we're getting about 100 to 120 new cases every day. As you guess, Kansas is large. It's rural mostly, but the cases, we have 109 counties. 8 of the counties are the hot spots. And those counties are the metropolitan areas and counties that, as you guess, have meat packing plants and or prisons. We have 2 prisons, well, 1 prison and 1 other institution that's had quite a few cases of COVID. So we are looking as we reopen, we are in, so here you had phase 1, which was the stay at home. And here we are looking at how you move from phase 1 to phase 2 when we're back. Some people are back in the office. So we're looking at contactless services. So we are, as of Monday, some individuals went back to the offices. The offices are locked. Individuals wear masks. We have changed the desk and the configuration. There is no direct customer contact for this 2-week period, and we will be monitoring what's happening in Kansas during that 2-week period to see if we are still having increased cases. So those individuals that are back in their offices are wearing their masks, they're maintaining social distances. As we said, the offices have been rearranged. We are going in, those that are going in at a half staff. So they've arranged alternate days. So there are even fewer people in the offices. And this is just the information that we shared with our staff. So you can kind of see how we talked about it with individuals. So we're planning during this 2-week period for entering to contactless services. And this is allowing for pickup, delivery, loan, demonstration, funding activities, information and referral, assessment, and training. But before even a contactless service is carried out, the staff are completing a customer screening for the coronavirus over the phone. And we have taken the coronavirus survey that our hospital has used and modified it somewhat. And you've got the question, you know, the standard questions, you know, do you have a cough? Are you tired? Do you have flu-like symptoms? And then, have you been in contact with someone in the past 14 days who has been suspected or confirmed to have COVID? And then with questions about what areas of the state have you traveled in, because, you know, we are reopening. And again, we've got hot spots. The states around us have hot spots. So we want to know, even before we go for a contactless service, if the individual has been in any of those situations that would lead to a yes. If they do answer yes, we explain that, you know, we will provide services, but we cannot schedule it at this time, and we will contact them again in 2 weeks. So if the person is okay and staff are going to deliver like our reuse devices, they arrange to actually deliver that to like the curb or the porch. They are not going into anyone's home. And so we've got steps on how to do that. All of the devices that we are delivering are bagged. And of course have been cleaned carefully beforehand and so forth. We have a little glitch in that we still need the signature for receiving equipment. We've got a plan for that, although we're looking at trying to just do away with that entirely. So then we just have the steps that we go through for the pickup process for the donations, very similar. Absolutely not going into people's homes. Here are our steps for the device demonstrations, very much like we've talked about on other ATAP calls. We will work with the individual first, have a discussion on what they might want to see. Then we will be sending out, we'll have a video chat, we'll show things. And then they'll make a, you know, I'd like to see X device, and then we will ship that device and then conduct another video review of that device. Our loans, as all of you I think have probably done too, we just told people if they had their devices in the past from us to keep those until we ask for them back. We have now asked for them back, so they're starting to come back in. And like Angela, we're cleaning and sanitizing those, of course, after they're coming in. Assessment and training, very much that same practice, no face-to-face as yet. That will be coming. So as we are moving forward to our phase 3, we monitor the incidence of COVID across all the counties. We tell our staff we recognize there may be some counties that you're not going into, and that is, you know, the way to proceed. So for June 16th through the 30th, if things, you know, move along smoothly, we will then start to have some face-to-face services. Our aim is to prioritize our customers with VR service authorizations, our ICANN Connect folks, and our TAP devices, individuals that we've had a history with before, and that we can conduct that face-to-face period of, you know, the goal is under 30 minutes. We don't want people in people's homes for a long period of time. And with this phase, as the other, we do the customer screening. And again, if you've got a yes, of course, we're not going into that area. And then we have, following 2 weeks, moving to phase 4. We're still looking at the hot counties. We are entering more counties at this point. I think I told you that staff are wearing masks. They're having gloves. They are working with people without touching, as obviously as much as possible. They will be taking their temperatures and sharing, taking their own temperature and then sharing the temperature, taking the temperature of the other individuals. So we just have all of those sources there. I think I missed a slide at the early section, and the slide there was the question about what we needed to do for our staff to support them. We have spent about $10,000 that we can document just on PPE for our 6 access sites, so that staff have plenty of supplies. They have the contactless thermometers. We've been very fortunate in securing all of that. Our tip there is we had a staff person start early and to find all of the PPE, and actually had our most success with local pharmacies. And they really stepped up and did a great job in securing this, the PPE for us. We're with the university. We probably could have used the university, but because the program is statewide, we engaged the local pharmacists. So we've spent about $10,000 on the PPE. Whoops. And we have spent, hopefully we're back, I don't know. And we have spent about $85,000 supporting our staff and subcontractors for services that they were not able to bill during this period. We didn't want to lose any of them. We didn't want them laying off staff. We've been very careful about like delivery folks and all of these individuals that help our program. So we found other jobs for them to do in this period, and we realigned our budget. And so, we total, I think our bill is at about $85,000 now, and that should hold us, we're hoping, through the fall. We've got enough supplies that I think we're covered until that point, and then we'll revisit. So that's the Kansas plan.
Great, thank you for that, Sarah. And Molly, bring us on home.
The new girl gets to be at the end. Perfect. I think this is some sort of hazing ritual, probably. Hello, everyone, and thank you, Amy, for organizing this. I think it's a great conversation for us to be having. For those of you that don't know me, which is probably everybody, my name is Molly Kimmel, and I'm coming to you from Missoula, Montana, home of Montech. And I have been at the helm here as the program director for about the last 6 weeks. So fun time to join the team, but it's actually gone really, really well. And I will give you a rundown of what we've been up to in Montana. I don't have a ton of screen sharing to do. So mainly you get to look at my face until I pull up our big document. But Montana has come off of this a little lucky, I guess you could say. We're already pretty good at distancing from one another with all the space that we have. And so our cases have been relatively low. And despite that, our governor did act pretty quickly and put in a shelter-in-place order at the end of March, which lasted for a month. So our team here at Montech was working from home from mid-March until about mid-April. And we've now entered phase 2 in Montana as of June 1st, which means that we no longer have a 14-day quarantine requirement for anyone coming from out of state. And restaurants and businesses are operating at about 75% capacity across the whole state. I think all of us in Montana are holding our breath a little bit to see what that means in the next week or two. And I know we're a wonderful place to visit, but we'll still be here next year, so just stay away. We are located here on the University of Montana campus, and Montech is run out of a USED, but our lead agency is the Department of Public Health and Human Services. We, despite both of those partnerships, are fairly autonomous, and so DPHHS really hasn't had a lot of say in our reopening plans and guidelines, not really any at all. And mainly I've been working with the university campus and the local health department. We have 2 labs in the state, one here in Missoula and one in Billings, but I've primarily worked with the Missoula County Health Department, as most of our operations are centered here in Missoula. Campus has been closed this whole time. Essential employees are allowed into offices, and for the most part, things are relatively quiet on campus. So when I started on April 21st, my first real task was determining how comfortable staff felt about coming back into the office and if they felt we were an essential service. And I did meet with every staff one-on-one and with our advisory council to get their opinion on that. Everybody felt like it was important, once we were safely able to do so, to begin resuming services. So by April 27th, I had permission from our president's office to begin curbside pickup and delivery of equipment, and to do small demonstrations, just 1 or 2 people in our lab. So I did submit a plan with our health department. They have a great form online that is just a retail opening plan, and it goes through step by step all the things that people should consider. If anybody wants to look at that, it's on the Missoula.gov website, I believe. And I didn't share that with Amy, but I'm happy to share our plan from the health department about reopening. We were not ready by April 27th to start our loan program yet, because our cleaning committee was still trying to find enough supplies to clean and sanitize all our equipment. And our lovely, amazing, fabulous cleaning committee has been meeting weekly since mid-March, and they initially thought they'd have 2 or 3 meetings and have it covered and just really be able to move forward. They've been meeting weekly for 1 to 2 hours, and that is just now starting to fade, because they have been so thorough and so detailed in their recommendations on how to clean every single piece of equipment in our inventory. And I appreciate that thoroughness, and I really recommend a committee look at that, because I am probably on one side of the spectrum where I'm willing to assume a little bit more risk, and we have people on the committee who are on the other side of the spectrum. And that's important to have, because every single vulnerable consumer, you want to feel comfortable with what's coming into their home. So we were able to beef up our inventory and supplies, and we opened for loans on May 14th. So most of our loans get shipped in and out through our university shipping system, but we do have people who are coming in, making an appointment and calling from the parking lot. So our admin goes and delivers the equipment that they've requested, or picks up things that people are dropping off. We have renovated our conference room, since we're not having conferences. So that is our staging area for when equipment comes in. It gets dropped off and tagged by batch in the conference room. Twice a week, there are teams of staff members, 2 people each day, who are responsible for cleaning what has come in. That cleaning, we're very lucky on space. We are able to distance. We have a lot of space available. We have 4 bathrooms. So we have transitioned the men's bathroom into our cleaning area, and that has required changing one of the windows so that it can be open and vented, installing a portable washing machine, and changing out the sink for a utility sink. And those 3 things have been incredibly helpful as we clean equipment. So those 2 people come in, and then they look at our lovely document that Amy has and will share out. It's extensive. I'm going to show part of it to you, and it's a work in progress. So this is constantly being looked at and evaluated, and this is about 2/3 of it. We still have most of our adaptive equipment is not in this document, because we're still working on some guidelines from manufacturers on how best to clean. So let me pull up one for you. And so right here we have about 30 pages. Everybody see that okay? Did that come through?
It came through, but you might want to just increase the view, magnify the view a little bit. Yeah, helpful. Thanks.
Perfect. So this is a perfect page to give you an example. We took all of our different equipment and put it into categories. So anything that can be cleaned the same way is in a category. And each of those pages can be a single page per category, front to back, that have all of the equipment that might be needed to clean it, as well as the cleaning and disinfection instructions. So very, very step by step. Of course, our cleaning team knows that you're going to wash your hands first and put on your gloves and put on your mask. But for each piece, we wanted it to be as comprehensive as possible. So we go through how to clean and then how to disinfect any potential items that are different, get a little shout out there, and then what do we do with it when it's done? This is the big document. We're working on two sister documents, which are, one is going to be more visual based, kind of like what Tracy showed, and we found some good options for that will be a little more clear to understand and quick and a little less detail oriented. The other document we want to create is one which lists all of the cleansers and disinfectants that we're using and what items are good for that. And if we are out of that cleanser or disinfectant, what is an alternate solution? So the other thing we're doing, and what I would recommend, is that there is an inventory that we're using, that we know exactly how much of all cleaning supplies we have and how quickly they go. So our admin is responsible for, every week she checks the inventory, she checks our items that are incredibly difficult to find. The university was not terribly helpful in partnering with us to have us buy similar equipment, so we are on our own with that. We're trying to find things online, again, because Montana is in a bit better place than some other states. We can find some things in stores. When I was at Costco last week and there was a 4-pack of Lysol spray, I just about cried. It was so exciting. So we're using this to help budget exactly how much all of these cleaning supplies are going to take out of our money. And most of that is coming from our wish list budget, unfortunately. So get back to my notes here. The things that we really considered in cleaning was what is easiest for staff, and that's about disinfectant time. Some of those disinfectants need a contact time of 10 minutes, and that takes up a lot of time. So anytime you can, getting something that takes 1 to 3 minutes of contact time is a huge benefit. We wanted to get things that were the safest for the staff to use, so they didn't feel like they were inhaling chemicals nonstop whenever they needed to clean. And we also needed to make sure that things were gentlest for our equipment. So that's where we have talked to a lot of manufacturers about what's our bare bones options, which is often 70% isopropyl alcohol wipes is kind of the ideal for most of our equipment, but we wanted to make sure that it would be effective as well. We really wanted to have the philosophy of better too much than not enough. So right now, is it a little bit of overkill? Potentially. We're cleaning everything as it comes in. We're cleaning everything, disinfecting everything again before it goes out. And we are doing an incredibly thorough job. But I would rather do that and be able to dial things back than have to ramp up what we're doing in the future. So I feel very, very safe. And I think our staff does too. And that's another thing that we're doing right now is I'm just doing frequent check-ins with staff about their level of comfort doing all of this. And I think as people come back into the office, you can see that little bit of return to old habits and things get a little lax. So I am also frequently making gentle reminders about distancing, about hygiene. We have 2 pages in that document about cleaning shared office spaces daily, things like that. So everybody right now feels really comfortable with what we're doing, and we want to maintain that for sure. We did, what I would recommend, a couple small things to other sites is we looked at our loan agreement and made sure we ran it by legal counsel at the university so that we had a little piece in there about injury, but we didn't have anything related to illness, and we wanted to make sure that our liability was covered in that regard. So we did change our loan agreement slightly. We've changed our packing slip as well, just to read, contact us if you have any questions regarding cleaning and disinfecting, because we didn't want somebody to, with a wonderful intentions, to take a Clorox wipe to an iPad and clean it that way. So we would prefer to clean it on our end, actually.
Or put it in the sink.
Yeah, go ahead. Usually we like to recycle our boxes, and we're not doing that right now. We're using all new boxes. It just looks better to the consumer. We are working on a system where we can have boxes be put away and away from any human contact for a week or 2 and then use them. I think we're all just extremely conscientious that if we're in the space and we're an asymptomatic carrier, that even if something hasn't been touched for 7 days, there is still a risk factor. So again, possibly a little overkill, but better that than the alternative for sure. One really good tip, those little tiny alcohol prep pads are garbage on cleaning anything large. So where you can, get PDI screen wipes, and they're nice and big and will take a lot less time. We are also, with all of our instruction manuals, since we can't send out paper, we are laminating quick start guides and making sure that we can wipe those down as they go in and come out, or referencing people to the website for manufacturer's instructions or instruction manuals. A lot of discussion as we look through older inventory about, is it cheaper and more cost effective to buy something new and get rid of something that just cannot be cleaned? And that's a tough conversation to have, and tough with budgeting, but really important when you think about the time that all of this requires. And I can tell you, having done loans for 2 weeks now, it is more time than I expected to take in our office. So our staff has been amazing about all of this. Take pictures. When you undo a really complicated stander and there's lots of straps, and those straps are going in the washing machine and you have to put them back on, take a picture, laminate it, and put it back on that piece of equipment so you can put it back together. That's another little helpful tip from Montana. I think that's about it. Like I said, we are open for demos as well, but not a lot of people have jumped on that. We're still primarily doing video conferencing or phone conferences for demos. If we do a demo, we're doing the screening calls again, just like everybody else, and wearing a mask and only allowing 2 people in the lab at this time. And like Angela said, we have 2 UV wands, but no guidelines on how to use them or how effective they are. Ours are kind of old, so it's hard to say if they would still be effective if we use them. So we're holding on to that. We're researching it every couple of weeks, but right now we are not using UV as an option for any sanitization. Whew. I think that's it for now. I'm going to pass it over to Amy so we have time for questions, but thank you all for being here.
Well, thank you so much, Molly. It just brings me back to the day we decided, no more cute, fuzzy animals in our toy inventory. It was a sad day, but it had to come. So thanks to all of you ladies. We did have a few questions. One about the brand thermometer that you're using, your contactless thermometer for your visitors and or staff. Do you know that offhand? No.
I don't know it offhand, but I can look it up and I'll share it. Because we had quite a search. We have and thermometers that will actually announce the temperature too for our visually impaired staff. So we had quite the hunt to find the equipment.
And our organization took care of that. Because we are a healthcare organization, they were able to get on Amazon and have access to things that normal people don't have access, or not normal, but non-medical people. So I have no idea what it is. It just has a little trigger. And ours, what they did decide to do, and this is something to think about, some of them, when you pull the trigger, it kind of looks like this. And so you're putting that to everybody's face, a kid's face and everything. And they said it doesn't look right. So they got another one. It's kind of more flat. So it doesn't look like a hand, a water pistol.
Okay. So I actually threw out the question about whether, for those of you in a university, you are running agreements or whatever by risk management. And I think, Molly, you did mention the legal review to add illness as well as injury. Let's see what else we have in here. Liability clauses to lend equipment. Pretty sure that most programs had some sort of liability. Hold harmless agreements, so that if they dropped a case on their toe, liability clauses are something that your legal department can help you with. You may need an outside lawyer. I'm sure we can share some examples of what those liability clauses look like. But generally, people have to sign that they assume any liability and will hold harmless the lending entity. And I know at Temple, it was like, because some of our funding was from the state, they'd hold harmless the state, they'd hold harmless the university, they'd hold harmless the USAID. So, that existed pre-COVID. What didn't exist is, as Molly pointed out, a clause that says not just injury, but also illness. So let's see. Martha mentioned a thermometer with great reviews, but in actuality, poor function, and then the reviews started coming in poor. So it might be that the company ramped up production, not in a good way, not with good quality control. Any other comments, questions from our audience? Not seeing any, so I guess this was pretty comprehensive, and really appreciate you sharing the benefit of your acquired knowledge. Oh, we did get one new message here. Oh, just lots of thanks and appreciation. So again, stay tuned for the archive of the webinar and the materials, including, what is it, 22 pages, Molly? 30 pages. The template that Indiana is using, courtesy of Alaska. Lots of things. We know our great state AT program is notorious in a good way for open sharing, borrowing, stealing. So, well, thanks everybody. Stay safe. And again, we will repeat this topic in a couple of months to see how we've come. So thanks for joining us today. Thank you, Angela, Molly, Tracy, Sarah, and have a good day, everybody.